So let's bring Professor Ying, the Dean of the Swee Hock School of Public Health at NUS, into the conversation. Professor Teo, the circuit breaker will be extended until June the 1st. When you were last on the show, you said that it should be extended by 2 weeks. So what do you think of the 4-week extension? Is it a case of the longer the better?
Well, I think over here we have to see this is aimed at a prudent decision because when I suggested to extend by 2 weeks, I mentioned it very clearly that we have to look at the data, and that was 1 week ago. So now we have additional information from the week that has passed. And looking at the information, there are two pieces of information that we know. Firstly, the circuit breaker has been effective. We have seen a reduction in daily case numbers when we focus on the community transmission, those that are not within the dormitories. Secondly, even though the numbers have come down, it hasn't really come down to the level that we were hoping for. Because after 2 weeks, we would be expecting some of the transmission in the community ought to have stopped. And based on some of the information that we see from the daily counts, some of the actions that are taken, particularly around the closure of McDonald's, as well as the closure of the construction sector, we see that the essential services are part of the reason why there are some leakages that are continuing seeding transmission in the community. So this is the reason why, even though the circuit breaker has been modestly successful, we still need to keep going at it and to extend it further. So rather than 2 weeks, it is prudent, better for businesses to plan with the perception that it will be happening for 4 weeks now.
Well, I believe it was Minister Lawrence Wong who said that if the government sees community numbers coming down to single digits, then it can consider gradually easing some of these circuit breaker measures. So, but do you think this is the best indication, or should we be stricter about this?
So, using the numbers, I think it is very important to highlight that it is always not just about the numbers on its own. So, Minister, when he used the numbers as an indicator, he made it very clear. It was not just a case of numbers coming down to perhaps single digit, but also including the unlinked cases that are happening in the community. So there are multiple factors that at their level, they actually have the data and the information to be very clear where the cases are coming from right now. And based on those information, this is where they have to take the necessary decision. It is not easy because it is not easy to now come after 2 weeks to say that we have to extend for a further 4 weeks. So just to make sure, this is not saying that the circuit breaker will end 4 weeks from now. It means that we are adding on an additional 4 weeks after the 4th of May. So we will end on the 1st of June. It is not easy for the government, for policymakers to come online to say that now we need to extend the circuit breaker. There is significant impact on businesses, on workers, on livelihoods. But the clear message here is that it is a very prudent measure that is necessary to protect health and lives. And that is the message that I got, that health and lives come first. We look after that first before we think about the economy. And I think this is where DPM also mentioned very clearly. There are additional fiscal support to help to look after the livelihoods of people. So I think that is the message that I got from the multi-ministry task force as well as from the Prime Minister.
I want to focus on a specific measure that was brought up in the press conference. Minister Wong said that in certain wet markets, the public will only permit the government will only permit entry on alternate days based on the NRIC or your FIN number. So they're going to start with wet markets, and maybe they will implement that in other popular areas. Do you think wet markets and possibly supermarkets are the best venues to pilot this measure?
So if we look at which places right now are the public most likely to congregate at right now, because We have been told very clearly, you leave the house only if you need to get your groceries, if you need to get medicine, if you need to get food supplies as well. So from that perspective, we will see very clearly wet markets, which is very much of the culture among Singaporeans, will be one area where people like you, me, our parents will be going to. And because of that nature, we need to put in place measures that will help to thin the crowd. And given that people are very likely to try and come together, go to the wet market at about the same time to get the best ingredients, the best, freshest fish and meat, by putting in place this measure based on the NRIC, it is trying to thin the crowd as much as possible by telling people today is your slot to go to the wet market. You go now, otherwise tomorrow it is not your slot. You have to find maybe 2 days later before you go again. So those are very important messages aiming to thin the crowd. Wet markets in the first instance and potentially maybe extended to other supermarkets as well. Those are the places right now in public where there are more people coming together, and the nature of the activity actually means that people necessarily are closer together.
Right. Well, let's turn our attention to the foreign worker dormitories. Minister for Manpower, Josephine Teo, said that all the workers staying in all the dorms will stop going to work. And this new condition applies to workers from all companies, including those that had earlier obtained exemptions to operate. But the Ministry of Trade and Industry will now notify to suspend operations for this period. So what do you make of this? Will it lead to a dramatic drop in the infections in the dormitories?
So we have to be very frank about this. Now we tell our foreign workers not to go to work. The impact is that it is likely there will be a fall in the transmission across different dormitories. So worker A from a worker from dormitory A will now not have the opportunity to interact or to spread the disease to other fellow workers at the same site from other dormitories. So this cut the transmission across the dormitories, which is a very important thing. Right now, Singapore has gazetted 18 dormitories. There are other dorms out there, then equally, there are other non-dormitory foreign workers out there. So we need to find a way that we don't have more dormitories being affected. So this is the first. Secondly, when we tell people that you don't work, the reality is that now these workers are in the dormitories for a much longer period of time. Previously, they'll be outside working, so the interactions within the dorm is usually during the evenings and nighttime. But now you are putting everyone within the dormitories. So this is where I'm at least very gratified that the multi-ministry task force have made it very clear. When we expect the dormitory workers to stay in the dorms, at the same time, we know that there will be some additional spread within the dorms. This is the reality. Measures are taken to try and minimize this spread, and equally now there are an enhancement of the medical care and support at the dormitories itself. So the dormitory workers will expect that if they are ill, they will be able to get access to medical care as early as possible, including if their symptoms worsen, they will have medical attention to the hospitals as quickly as possible.
Right. Let's revisit something that you were saying before PM Lee's address. We were talking about whether you expected the majority of the foreign workers who are infected, their ability to fight off the virus. So could you continue that answer? Do you believe that the majority of them will be able to recover?
So let's look at what we know about the disease from countries that have been very worse affected by this condition, by coronavirus. In China, in South Korea, in Italy, in Spain, we see the data very clearly. People within the age group, typically from 20 years old to 50 years old, those would be the majority of the migrant workers that we have in Singapore. That's the age segment, 20 years old to 50 years old. The the severity of the coronavirus infection in this age group is actually much, much lesser. So what this means is that even though we see very frightening numbers like 1,000 dormitory workers being infected every day, what we expect is that a very small fraction of them will actually progress to a stage where they need maybe intense oxygen treatment. So the vast majority of the migrant workers will actually have very mild symptoms. And I think this is the silver lining amidst a very gloomy situation right now. And because of that, we must calibrate our national strategies accordingly. And this is where, based on today's announcement, we have seen that some of the foreign workers that are affected, they will now be housed in special blocks within the dormitories itself, with the addition of medical attention and medical teams that will provide the clinical support for these foreign workers.
Right. I guess on the note of a silver lining, let's look ahead. When the circuit breaker eventually lifts, whenever that will be, which measures do you think will be eased the first?
So it's quite interesting that the measures will actually last until June. Because again, I will come back to what we know about the disease. What we know about the disease is that actually children are very unlikely to suffer very severe consequences. The data right now worldwide suggests that actually children are least likely to be affected by the coronavirus. And those are information that we use not just in Singapore, but governments worldwide are looking at this data to decide what are the measures to take. So actually, one of the easing was actually schools, that there are strategy documents from other countries, including European countries, including America, that talks about how schools can potentially be amongst the first to open because children are at very low risk. But because now I mentioned it is interesting, it is June, because that ties in with the June holidays. We will need to see whether there is any clarifications where, because of the additional circuit breaker, there may be schools that need to come in for children need to go back to school a couple of weeks in June. So I think that is something we will wait for the Ministry of Education for further clarification. So schools is one. Actually, on the other hand, there will be other sectors that we are very clear that can be relaxed. For example, some workplaces can resume first, but the vast majority are actually on this commuting work. And this is where we need to properly evaluate what are the sectors that can continue a telecommute model, meaning even after circuit breaker release is eased, most of these people will still work from home. Equally, for food and beverage outlets, we need to look at perhaps the takeaway model will still remain. Dining in may still not be allowed for an extended period for a while more. So there will be certain measures that can be eased, certain measures that will still have to remain. And I see that as a necessary strategy when countries, not just Singapore, start to plan what do we do after easing this circuit breaker model.
Right. Well, thank you as always for your time, Prof.